is Mel Garcia, and I'm here to support my fellow co-worker mental health therapists to support the racial injustice of them not being able to have MLK Day off.
Sure. My name is Sabrina Chilmet. I'm a therapist in adult psychiatry in Oakland.
How long have you worked for Kaiser?
For 14 years.
And today you're out here on MLK birthday,
Yes.
Not as a holiday, but on strike. What does it mean to go on strike on Martin Luther King's birthday?
It means doing the bus boycott. It means riding the bus with the members of SNCC down south to protest against voting disenfranchisement. It means talking about the national issue we're having where we're losing voting rights in places like Texas and Georgia, where in Texas they're removing voting boxes in one of the largest counties. In Georgia, they're making it illegal to give people water. So I think this is national, not just local.
And the Kaiser says they're a nonprofit, but yet apparently their salaries of the executives are quite high. They have a multi-billion-dollar fund. Why aren't they using that money for the patients and the people that need to be taken care of?
Because I think they think the model works, and they're not on the ground. They don't come into the clinics every day. They don't see the number of patients we see, or that it's a 4-month wait list to see a provider of color. I don't think they want to talk to us about it. I think they're kind of indifferent.
And they promised that they were going to try to fight systemic racism, but apparently they haven't kept that promise?
No, they put up posters, and they have a EID committee, Equity, Inclusion, and Diversity, but having a committee and posters all around the hospitals is not the same as walking your talk.
And the issue of black, brown people being able to see professionals to deal with their health issues, how is that important?
It's important to me because I call myself one of the Supremes, because I've never been more than 3 black clinicians in Kaiser, Oakland in the 10 years I've been there. So when a patient says, I want to see a black therapist, they're prepared to wait an extra month or 2. My appointments fill very quickly.
And Kaiser's been fined millions of dollars for refusing to take care of patients that have mental health. Why haven't they been prosecuted? It seems like it'd be criminal to say that they're providing this service for millions of Kaiser members, yet they don't do it.
I don't know why. They seem to be able to justify in their workarounds. Like they'll put somebody to see a screener and they act like it's a therapy appointment. They do connect to care programs. That's how they justify and say that everything's okay.
And some patients unfortunately have committed suicide.
Yes, they have.
I mean, have you dealt with people who need care and aren't able to get it?
Yes. Often our patients, just to meet the threshold to come in for treatment, they have to have a diagnosable condition. So we're seeing a lot of patients with depression right now and anxiety, and they're having to wait still 3 to 4 months to see a provider. Appointments for April just opened up.
And the pandemic, how has that added to mental health stress?
Oh gosh, it's added, more people have post-traumatic stress disorders. They're isolated, they might have lost housing and jobs, they're very afraid, they're sick, they've lost people to COVID or they have COVID. So it's just, I feel like it's magnified the need. It really showed that the model isn't working.
And the people of color particularly are being affected by this pandemic more than others?
Yeah, I think 70% of those who have COVID are black. And they need to see a provider that looks like them because they're worried that if they're seen, they won't be treated well by a non-black clinician. And they might want to talk about racism, they might want to talk about police violence, things like George Floyd being killed. Those things happen all the time. And so they want to talk to somebody who will understand that it could happen to me. Yes.
And I mean the stress even on yourself, seeing that situation where you want to help people and even your own family members, it must be traumatic in itself.
It is, because I feel so helpless. I've experienced something called moral injury where you can't do what you want to do to help and you're stuck in a system. I don't want to leave because people could not afford my rates. And so I choose to stay as a vocation. It means something to me to provide care to all communities.
And right now, in the middle of a pandemic, we still don't have single-payer national public health care. That's something MLK was fighting for at his time.
Yes, he was.
And
yeah. And he was also fighting for the reason he was against the Vietnam War, because he said, who gets sent to the front lines? The poor and the poor of color. So civil rights applies to all kinds of people who are marginalized.
And the budget, it seems, of the military, $800 billion. They have money for that, but not national health care. Is there a contradiction in justice?
It is, because anytime there's a shooting, they say, where was mental health? They always say, where was mental health? And they don't see how undersupplied we are with resources.
He's a young poet and the son of one of our NUHW leaders who couldn't be here today, unfortunately, because of illness. So let's give a warm welcome to Dinari. Bye.
Speaking as a young black man, somewhere I read about civil rights, the labor movement, and religious communities coming together in 1968 the way we are today. And that a strike in Memphis raised the voices of sanitation workers the way you're raised today. I read that they left their jobs to go to the streets for dignity, equality, and decency. That it takes a strong mind to leave what's comfortable to make a change. Because economic strikes are social struggles. I read that despite their nonviolence, police attacked with violence the way they do now. Somewhere I read about the demand was for a city to respect the dignity of its labor force. And that professional workers go on strike too. Because somewhere they read a freedom of speech, freedom of assembly, freedom of press, and freedom to protest, because the greatness of America is about we. So when you strike as mental health workers, you strike for us, all of us. For the environmental issue of healthcare that is disproportionately not accessible to all. For equality in mental health care, because mental health is public health and should represent and serve the people. To gain more than 5 black mental health workers in a psychiatric clinic serving a 25% black city with 90,000 black residents. Thank you. To plug off for your family at night without the unfair demands or the thoughts of patients you can't meet this month following you to bed. So my mom can hang with me on MLK, so my doctors and therapists can have the day off. So I strike, because access to mental health is a civil right, because somewhere I read that MLK Day is a state and national holiday. And therefore, MLK Day for mental health workers has been law. It continues to be law. Thank you.
Eric. I'm basically here to support my colleagues, people of color. I'm here to support NUHW, the healthcare workers. And, I think Kaiser should respect the promise they made to give us this day off this year, not next year. Put action behind their words. 40 billion.
Why did they take that position?
Why do I take that position? Because since Reagan was president and this day, MLK Jr. Day, was a national holiday, a federal holiday, Kaiser's had the chance to give us this privilege of having the day off, and they haven't. They forced it to take PTO and do voluntary work or something like that. So, yeah, now we're fighting to have it recognized as a holiday, and they've acknowledged that next year. But they didn't honor their promise this year, so that's why we're out here,
There's recent strike of the engineers, which was defeated, apparently. How do you feel about Kaiser's breaking of the engineers union strike?
It stinks like union busting, that is for sure. The engineers were out for 90 days just about. We went out in sympathy, so there's also been talk that this is retaliation for us going out in sympathy. NUHW, the nurses union, SEIU almost went out. We definitely support the engineers. So that was a disaster, and thank God they still exist. But a lot of those employees left because they couldn't sustain being on strike without pay. It was a travesty. Horrible. And Kaiser calls themselves a union shop. It's totally hypocritical.
And there's a bill to make public health care single payer in California. What do you think about Kaiser continuing to be privately run?
I'm not sure I can speak to that one, but
You think there should be private health care in this country?
no, I'm half Danish. My mother's from Denmark. It's socialized medicine. I benefited from it all my life as a Danish citizen as well. So, yeah, I love that model. I think the U.S. should follow it, but of course, we're all about the almighty dollar, so I doubt that's going to happen.
So, they say that they're a non-profit, Kaiser, yet apparently their executives are highly paid. They're making millions of dollars?
Millions of dollars, millions of dollars. I have no idea why that's the case, why a CEO of a healthcare company should make 15 million. You know, thank God for the unions. That's all I can say. If we weren't organized, they'd be stepping all over us even more.
Sal Roselli, president of National Union of Healthcare Workers. We're here today to draw attention to the institutional racism that exists in Kaiser. And for 2 years now, our union's BIPAC committee, the clinicians, mental health clinicians here in the East Bay, have been trying to work with Kaiser to address the institutional racism, and Kaiser is simply giving lip service. So we're here to draw attention to that.
Megan Rosser, union steward over at Kaiser Oakland Adult Psychiatry, and we were asked, this week by Kaiser to think of, quotes from Martin Luther King to honor him, and I was just thinking of the quote of. Peace is not merely the absence of violence, but the presence of justice. So I want to ask Kaiser, probably no one's actually in there working today, I bet, but justice would look like some kind of parity between mental health and medical services. Justice would look like no one having to wait 2 or 3 months for an appointment, and it would certainly look like a black person wanting to speak to a black therapist not having to wait 4 months for an appointment. So I'll just end with another quote that's on these signs. The time is always right to do what is right. So Kaiser, what are you waiting for?
Add my rant to the end, which is, Kaiser, we implore you, health and racial justice, we cannot foster one without the other. Change lip service to systemic change. Heed the call of we mental health workers. Use the wisdom of folks of color, people of transgender experience, and others who have been excluded or silenced, so we can be better. Be actively anti-racist, trans-inclusive, and dismantle ableist white supremacist practice. We need a more sustainable and healing workplace and healthcare system, or you will lose us to the poison of ongoing, unchecked systems of oppression, to burnout, and the burden born of being complicit in a system that harms KP members. This is an opportunity to put slogan into practice, to be a beacon to hold patients and employees above profits. Black Lives Matter.
Dr. King, one of the greatest Americans, one of the greatest human beings that we have known in recent history. I think that if you would follow his example, we'll have a much better world to live in.
So most companies have this off as a holiday. Why would Kaiser, which presents itself as a quote-unquote progressive organization, not agree to Martin Luther King?
Yeah, that's a great question for them. I mean, that's what everybody wants to know. I mean, what are they thinking? I mean, why is it that they say something and do the opposite? Unfortunately, we see that companies in general, want to look after the bottom line. The rest of the stuff, goes out the window. We are telling them that they need to do what they say they do, to put their mouth where their money is and start doing the right thing.
And there's a bill in California for single payer. Kaiser is fighting it. These other privately run Sutter are fighting. What do you think about the issue of single payer and also the taking out of the control of the Kaiser, the operation of the hospital?
Well, I mean, I think that, single payer is probably one of the biggest demands of the American people today, health care.
In the middle of a pandemic.
In the middle of the pandemic, I mean, if you don't recognize the role of the state, if you don't recognize the work of health care workers, I mean, I think that you haven't learned anything. Yeah, I mean, I think that the pandemic should have been a good opportunity to learn the role that the government has, and, and making sure that society can prosper and develop in a healthy way. Unfortunately, I mean, these folks, corporations such as Kaiser, have decided to ignore those learnings.
And MLK was fighting for national health care at the time he was alive.
Absolutely. I mean, I think that, that's a key thing to remember about Dr. King. And I think that there's a lot of, for lack of a better word, whitewashing, of his legacy. I think that it is clear that Dr. King was also concerned about the plight of workers in general, not just African American, but everybody. And
he was killed for supporting a strike.
Absolutely, so we feel here, being with our brothers and sisters of the labor movement, we feel that this is a way to honor his memory, and hopefully we'll have more MLKs in this country to keep fighting and moving our struggle forward.
She's an NUHW leader in Richmond, and where she leads and she's been the founder of the La Clinica treatment program. Let's give it up for our very own Jessica Dominguez.
Maybe I'll keep it on. My name is Jessica Dominguez. I'm a Chicana, proud daughter of immigrants from Mexico, an Oakland resident, and a founder of the La Clinica program in Richmond. I'd like to start by acknowledging the land we're on, land that belonged to the Muwekma, Chochenyo, and Ohlone people. It's important we acknowledge that we are on stolen land, and to honor our ancestors and thank them for sharing with us today their strength, wisdom, resilience, and sacred rage. We are living in a time of reckoning, a time where people of color are no longer content with status quo, because status quo has never included people of color. Status quo is white supremacy, English only, inequity, lack of access to health care, and the refusal from those in power to acknowledge any of it, all so that they continue to abuse their power. We see this play out every day at work and throughout the nation. Even now, as we honor the legacy of Dr. King and how he fought for civil rights, many in power today will say how they admire him, how they honor him, and with that very breath will actively fight to destroy voting rights for BIPOC communities in this country. And we see this with the structural and systemic racism that is baked into the Kaiser system. It continues to harm BIPOC communities and BIPOC clinicians, and yet Kaiser leadership continues to gaslight us and tells us and the public to not believe what we hear, see, feel, and know to be real. Kaiser ignores our pleas and says we're publicizing and weaponizing this only because our contract is up and because we're in negotiations. Well, to Kaiser I say this: people of color don't stop being people of color when negotiations are done. Racism within the Kaiser system does not end when we ratify a contract. These issues are deeply embedded in this system and will not simply go away. And it is not enough to denounce racism. We must be anti-racist. Anti-racism requires action on all of our parts, from Kaiser leadership and management to unions and labor. We will not give up and we will not give in, because mental health is a social justice issue. As a young child growing up in Central Valley, my family worked in the fields as farm laborers. I learned early on about Dr. King and his legacy because of his support of Cesar Chavez and the labor movement that Chavez led. In 1966, Dr. King wrote Chavez saying, "We are together with you in spirit. Our separate struggles are really one. A struggle for freedom, for dignity, and for humanity." 56 years later, and the struggle continues. La lucha sigue. And to Dr. King, to our ancestors, I say, we will continue to fight for social justice and civil rights, for voting rights in this country, and for anti-racist practices within systems like Kaiser. We are the people, and the people have the power. Si se puede, Black Lives Matter.
My name's Tom Painter. Out here today to protest Kaiser's not honoring Martin Luther King Day as a holiday for their therapists since 1982 when Ronald Reagan was president. You remember him, right? So because we're on strike today, in part, Kaiser is recognizing it starting next year, but they had promised to recognize it this year, but went back on their word. So we're very angry and upset, and we're here to make our feelings known.
And you're also without a contract. Is Kaiser trying to do to you what they did to the engineers here?
I wouldn't say it's as severe as what they did to the engineers. The engineers were out like, I think 4 or 5 months, or I forget how long. But
90 days.
90 days.
Yeah, 90 days.
But our contract negotiations have really stalled out. We're coming to the table with proposals, and Kaiser is not coming up with the proposals, and they're leaving early, coming late. It's the same kind of stuff we've been dealing with ever since the beginning of our union many years ago.
And the executives make a lot of money. They say they're a non-profit, but they're making millions of dollars.
Yeah, I think like $6 million or something for Greg Adams, some of the top people. So yeah, it is very disappointing.
And there's a bill in California to make healthcare public. Do you think Kaiser should be privately run?
Oh no, I'm in favor of single payer. It happened ever since I first heard of it. So I hope Kaiser stands behind that and it'll improve the health of our country.
I don't like to be public front and center. This is really hard for me to do. But I've been reading more and more Martin Luther King's work around standing up and standing alone sometimes for what you believe in, standing for those who can't. My family came from Haiti in 1967. We were fleeing persecution. We lost everything when we came to this country. So we had to rebuild our lives. And my mom taught us how to be advocates because she said, when everything gets taken away from you, your money and your home, you still have your education, do the best you can. On the 2nd of January, I lost my brother. My brother was one of the chronically mentally ill. He was homeless. He was dually diagnosed, schizoaffective disorder and substance use disorder. So I'm here today for him because sometimes he came to the hospitals where I was the clinician. And sometimes he would hear my name paged overhead and they thought he was having a psychotic episode. But he was actually hearing his sister's name be called to another unit. And so I'm here today to say, this is not a weaponizing moment. We speak for those who cannot speak for themselves. We speak for those who are lost and broken. This is my bus boycott. This is my sitting at the lunch counter. This is me riding the bus to the south with the SNCC members. This is me saying no to riding the bus and walking instead or getting a ride from friends. This is what MLK would have done. I've given up comfort. I'm not going to get paid today. I know Kaiser thinks this is about the money, but today I walked in solidarity with my brothers and sisters, our allies and friends, and we speak for those who cannot speak for themselves so that I don't have to keep telling my Kaiser patients why I'm working on MLK Day. And then Kaiser says we're weaponizing it because they're giving it to us in 2023. But if you read Martin Luther King's letter from the Birmingham jail, he said, we have been waiting 300 years for civil rights. And when Kaiser told us, wait, you're getting it next year, this felt like we are in that Birmingham jail and we are writing the letter saying, too long to wait. And this is why I'm here today. Thank you.
Why are we here? It's a holiday. We're supposed to be out observing and celebrating all the work of Dr. King and those before Dr. King and those before us. We're supposed to be having a good time. I am having a good time. I'm so happy to be here because when we, I'll stop touching that. In 1985, the IBEW, International Brotherhood of Electrical Workers, said to me, Rich, during this particular holiday that I take off because I have to, they said, well, go ahead and take the day off and we'll just mark it as a sick day. I said, well, I'm not sick. And they said, well, being that you're a foreman, it's kind of important that we literally have a excuse for why you're not here. the fact that I'm observing Dr. King's birthday was not a good enough excuse for the IBEW, Local 302. 1985, that's what happened. 1986, the IBEW, Local 302, across the whole county of Contra Costa, observed Dr. King's holiday. In those critical areas where they had to be at work, they enjoyed Dr. King's holiday as a paid holiday. The reason I'm bringing this to your attention is it's not enough to be angry, upset, and go away. It is for you to stand up and speak up and say, something's not right. And we know what John Lewis said, when you see something not right, you make a change, you fix it, you do something about it. I have been listening to my favorite person, Dr. King, all my life. The people that worked with Dr. King, his lieutenants and so forth, as I mentioned, John Lewis, I take their words to heart. And I try and employ these, and I try and share these with anybody within arm's reach. Because if you think about it, Dr. King probably would rather be here, but he knew that as bad as we can be, as I don't want to say ignorant, I'll say, well, I'm sorry, okay. As ignorant as we want to pretend to be, he knew there would be some sacrifices. So Dr. King had a dream. Now, that brings me to my city. I live in a little place called Rio Vista, in a nice little gated community. I'm sorry, I'm gonna take this off. Nice little gated community where we don't have a whole lot of people bothering us. And I was one of the youngest people there. It's a retirement type community. And I ran around saying, hey, Dr. King's birthday, we need to make sure we're doing something about that. We need to make sure we're observing it. And we need to make sure that Black History Month and all these things that we've done in Berkeley and we have observed in Berkeley all these years, we do it here too. Yeah, that's about the applause I got when I brought that up. Now, listen. Rio Vista, the city of Rio Vista, less than 7% African American. I'm 55 years old, and I'm not now, I'm a little bit older now. But for me to come into this community and say, hey, y'all need to make some changes, when they've worked all their lives, some of them probably walked with Dr. King, for me to come in and say we need to step up and do something more, they didn't take it too well. I got all kind of bad messages about I need to take that to some other city. We won't go there. But the end result was I ended up running for mayor of the city. I did not win. I ran for the city council. I was not selected. I applied for the planning commission. I was not selected. Okay, why am I bringing this to your attention? Because I got to keep doing it. Yeah. Now, here's the plus part. For what we're doing, let's look at the background, okay? We know that news and social media continue to document examples of discrimination and systemic racism within our society, and the Rio Vista community is not immune, okay? They understand the adverse impacts of discrimination and systemic racism that it has on a community, but not their community, because we don't have it. We don't have a whole lot of black people in the first place. But with that being said, it was important that people like me, people who stood with me, said it doesn't matter whether it affects you directly or it does not affect you. It does affect you indirectly. So we need to do something about it. So with that understanding that we have to deal with people that are not us, look like us, but maybe in a marginalized community, they're going to be more likely to have things happen that create shorter lifespans. They're going to be living beyond their self-sufficient standards. They're going to experience things like barriers to accessing health care and have higher rates of school dropout and a higher rate of death, premature death. So the city actively adopted a resolution that allows them to show that they're going to stand with, again, less than 7% African American. But they said, we are going to show that just because it doesn't affect us directly, we're going to show that we still care. So the city did adopt a resolution expressing its opposition to all forms of racism, bigotry, hatred, and upholding the dignity and equal rights of every resident of the city. This great discrimination and systemic racism, it manifests in different ways, in distinct ways across many social intersections, including race, gender, identity, sexual orientation, class, disability, immigration status, and age. However, this resolution that we adopted, we understand that the council by itself having this resolution is not enough. So the council and staff must be ever vigilant to ensure that there is no discrimination, systemic racism in our public sector, in our city, and it's time that the city itself has done this, and they're working on it. We're still working on it, but it was important that we took the position and work to bring this to a point where everyone can say in a city that Black Lives Matter, all lives matter because we did the work. So I just want to bring that to your attention. Keep doing what you're doing. Dr. King said we want all our rights. We want them here, and we want them now.
Escucha, escucha,